Hello, my name is Brian Hendon, and I founded an organization called Apollo in 2013. And the vision and the mission of Apollo was to find alternative therapies where physicians just weren't comfortable. So the story is, in 2012, I co-founded today what is the largest pain clinic in this country, treating patients who need hospital procedures in the community, because at the time, in 2012, for a surgical procedure for chronic pain, the wait list at times could be 5 years. So what my brother, myself, and a physician named Dr. Kevin Smith, we opened up a clinic called Alivio Pain Management. Today, Alivio has neurologists, physiatrists, anesthesiologists, some of the top pain doctors in Canada. In fact, 3 chiefs of pain from 3 different Toronto hospitals all work inside this clinic that people told us was impossible. Now, the story really starts for Apollo there. In 2013, the clinic started to really gain some momentum. But the problem was, we might have had the latest technology and the best doctors and a clear vision for trying to do what was right. But the problem was, every doctor was not comfortable prescribing cannabis. So patients were saying that cannabis is effective for them, but yet the most academic and the most respected physicians weren't comfortable prescribing cannabis. So what I decided to do was create a company designed to create and validate that research. So in 2012, 2013, I started working with researchers at the University of Guelph and other physicians and researchers, and we then launched a company called Apollo. So today, Apollo has tracked about 10,000 patient interactions, all using medical marijuana. And what I really wanted to talk to you about today was how, through that experience, we knew that cannabis was going to be effective for pain. We really had I won't say we knew, we really truly believed that if we did the research, it would prevail, that cannabis is an effective treatment. But what we didn't anticipate was how strong the results would be for patients with PTSD. So in 2016, so March of this year, we launched a PTSD study looking at just how effective it is in comparison to other meds. So without further ado, I'd like to introduce Dr. Tanya.
Thank you. So I'm just going to go over medical cannabis and PTSD and how it all relates to Apollo. So just some of the stuff I'm going to be covering, just elaborating more on what Brian has mentioned. So, as he indicated, Apollo Applied Research began in 2013, and the objective is to collect and measure patient outcomes to assess the therapeutic effects of medical cannabis. We have up to date over 10,000 patient interactions all across Canada, and treating patients that suffer from a variety of conditions, such as chronic pain, PTSD, depression, anxiety, fibromyalgia, neuropathic pain, cancer, seizure, and the list goes on. So how does it work? Well, patients can come to an Apollo clinic, or they can use telemedicine. And the purpose of telemedicine is that it allows us to see patients all across Ontario without having them to leave their city. And that's something that we could set up so patients can comfortably have a consultation by a Health Canada approved system through a telemedicine consultation. Or they can attend one of our affiliated clinics in different provinces. So the physician will assess if medical cannabis is a suitable treatment option, and if so, the patient will obtain a medical document, so a cannabis prescription. The patient then will be registered with a Health Canada approved licensed producer, and then the patient will receive education. And the education will go through all the necessities so the patient can go home feeling comfortable if they choose to begin therapy with medical cannabis. So strain selection, dosage, usage, side effects, the legalities and current regulations, and purchase and delivery of the medication. Once prescribed, the patient will have the opportunity to enroll in Apollo's observational study. So medical cannabis and PTSD. So the purpose of our PTSD study is it's an observational trial for medical cannabis in the treatment of post-traumatic stress disorder and its associated symptoms. As Brian mentioned, it was launched in March of 2016. We are recruiting 350 patients, patients can already be using medical cannabis, or it could be completely new for them. The duration of the study is 4 months. So far, we've noticed from the patients that have already enrolled, majority are civilians, veterans, and first responders. So just to give you an idea of the percentage between the difference. And we've also noticed that majority of the patients enrolled are more male than female. We've also noticed that almost 50% of the patients that have enrolled have unfortunately been dealing with PTSD for over 10 years. And we've noticed that there are other conditions that associate with their PTSD, such as depression, sleep disorders, anxiety, and chronic pain. So who can enroll in the study? Well, it's a patient with a valid medical cannabis prescription and a diagnosis with PTSD. It is 4 months, and all that's required is a 15-minute questionnaire once a month. And then patients will ask, well, what if I'm not diagnosed, but it's pretty evident that they do have PTSD? Well, we do have psychiatrists that can assess and diagnose the patient. So why join the study? Well, our objective is to complete our research so that we can publish validated evidence, because there's just not enough out there, and educate and empower patients and physicians all over the world. This will allow us to provide insurance companies with the necessary data required for medical cannabis coverage, and it will help influence public policy. So just to give you a little bit about medical cannabis quickly. So medical cannabis, it can compose of a variety of different components, but the two main makeup of it is THC and CBD. So THC can help with a variety of different symptoms. As you can see, it's a great pain reliever. It has almost 20 times the power of aspirin and hydrocortisone. It's a great muscle relaxant, and it's fantastic for appetite stimulating, especially for cancer patients and HIV and AIDS patients. And it is the primary psychoactive component of cannabis. CBD has wonderful properties as well, such as anti-inflammatory. It's great for pain, nausea, vomiting, circulation, anxiety, helps with seizures, and it has antipsychotic effects. So medical cannabis is composed of a variety of different molecules, but this pile gives you just a little bit of an example of what components. So CBD and THC are definitely way more heavy than the other components. And just to give you a little bit of